More than 100 people die every day in the United States from an opioid overdose, and many of those dealing with addiction first started with a doctor's prescription. 6 on Your Side's Karen Lair tonight joins us live in studio with more on how students at Idaho's First Medical School are learning about alternative options in tonight's installment of Finding Hope.
Well, Roland, while opioids do still serve an important purpose for some patients, in many cases doctors say they aren't needed. So these new students are exploring other ways to address pain concerns before pulling out that prescription pad.
Now I can start to narrow into exactly which vertebra here seems to be tight.
Inside Idaho's First Medical School, the state's next generation of doctors is learning about osteopathic principles and practices, or OPP.
I can feel that there's more tension there. Low back pain and neck pain are two very common things.
Part of the osteopathic philosophy is to look at the person as a whole. So what are all the things that are playing into the disease state, the injury, whatever may be going on with them.
And then I move down the cervical spine.
As more and more Americans become aware of the potential addictive properties of prescription painkillers, faculty at Idaho's College of Osteopathic Medicine spend part of their modern curriculum teaching med students about the all-important alternatives to treating everyday ailments.
In the middle of this opiate crisis, we've had some issues with overprescribing.
Dr. Dennis Rao Jr. says some data shows patients can be sensitized to opioids in an addictive way in just 7 days of use.
Certainly it helps to have other tools in the toolbox so that you can either delay or maybe even not prescribe opiates.
While opioids may be indicated in some instances, such as cancer pain or in a post-surgical situation, for many of the common things that we see, there are other treatments that we can use.
So Alex, let me have you take a seat on the table.
Students spend 200 hours of their first and second years in this lab putting their lessons to the test through hands-on experience working on each other.
They really like the course in that it is different from their other courses where they just study and memorize a lot of things. Although their patients per se are just other classmates, they do get that feedback from them, too rough, too little, so essentially their classmate partners are their first patients, and so in that regard, students really like to apply the hands-on knowledge.
Hands-on knowledge that will help relieve patient pain while keeping opioids out of the hands of those who don't need them. Karen Lair, 6 on Your Side.